Hey, OncoPTs, and welcome back to another episode of the OncoPT podcast. We're going to start this episode with a little mindful imagination. Now, if you're driving, please don't close your eyes. But if you're in a position where you can maybe just close your eyes with me for a little bit, go ahead and do that now. So I want you to picture this. You arrive at work in the morning and you're ready to go. The old sinking feeling in your stomach, worrying about what patients are on your schedule and what they're diagnosed with and what they're experiencing, this potential concern over the overwhelming combination of impairments that they could possibly experience is gone. It is evaporated. The sinking feeling is replaced by peace and even excitement to see what comes your way today. Imagine making a real difference in the lives of your oncology patients, finding fulfillment in your career, and opening up doors to incredible opportunities that you can't even imagine yet. Go ahead and open your eyes. This isn't a dream. This is actually reality. And it can be reality. It can be your reality. Feeling confidently certain that you can address your patient's impairments no matter the diagnosis, no matter the treatments that they've undergone, what complications they may face, is possible. But the path to this confident competence, or this competent confidence, whichever combination you prefer first, may be a path that you're actually avoiding, intentionally or unintentionally. Are you ready to hear what it is? Specialization. I know. Cue the eye roll now that I see already forming in some of your minds. But hear me out. There's a ton of reasons why I keep talking about this topic. And in today's episode, we're exploring 5 fantastic reasons why 2023 should be the year that you really set your sights on this path and even consider sitting for the ABPTS Oncology Specialty Certification exam. So, if you don't already have them, grab your favorite headphones, like I'm wearing right now, and let's embark on this journey that really explores not just specialization as a new set of letters after your name, right? There is a real purpose behind specialization if you pursue it correctly. If you pursue it intentionally, I know, because of what I've experienced in my own practice, that specialization has set me apart as a clinician in my area as truly one of the best fits for my patients. And perhaps scariest of all is that I should not be experiencing that. Like, I should not be, on paper, I should not be the best clinician in my area for my patients because of how many clinicians there are in my area. Generally, like, there's a lot of physical therapists in my area, and that's good. That's a good thing. It's not oversaturated like some people talk about. But the problem is that there are very, very few clinicians who are comfortable and confident and competent when it comes to treating these oncology patients. And what I have seen over the past few years, because of this, is really problematic and frankly downright tragic for our patients. And so I hope you will really, really take me seriously and hear me out when I'm talking about specialization today, because it is a really, really big deal. And I'm seeing the consequences in my backyard of when patients don't have the appropriate resources, aka you, the confident, competent. Did I say that too many times? I'm trying to say confident, competent. Yeah, I think that's it. Confident, competent, comfortable clinician to actually treat these oncology patients. So before I talk myself out of my sayings here, let's go ahead and dive in. So number 1, the first reason you should really consider specialization is impacting the lives of your patients. And I hope this is the first reason that you lead with when it comes to your why of being an OncoPT. You, as the oncology physical therapist, possess a profound ability to positively influence the lives of your patients dealing with cancer. Cancer sucks all day, every day. And the unique challenges that these patients can face extend beyond just the medical treatments, right? They encompass the physical and emotional toll that this disease and its treatments can take. And by pursuing oncology specialization, you gain the expertise to truly address these challenges head on, which is so important. As we know, our patients experience a lot of complications, and we need a provider who can actually step up to the plate with an air of confidence, with a true experience of confidence, and say, I know how to address this. I know how to help with this particular issue that you're facing. Because I'm seeing, like I said, I'm seeing a lot of not that these days. And so by really charging forward to meet these challenges head on, you are helping to provide a crucial layer of care that these patients often lack. And in doing so, you're helping your patients not just survive after a cancer diagnosis, but to live and truly thrive. And that's what we're after in cancer rehab. So if you'll remember, a few weeks ago on the podcast, I shared a story about a patient that I had who had metastatic breast cancer. We knew she had a timeline, right? We knew there was an end date. We didn't know what it was. We knew that we were kind of progressing towards some kind of an end date at some point. So there was no getting around it. Like, we knew what we were working with. But in the time that we were working together, we had some very specific goals. Specifically, this patient wanted to feel better despite living with metastatic breast cancer and still undergoing treatments. And the way we identified together is that she was going to feel better is by getting out and moving some more. This was something she was interested in. She was ready to try. We had problem solved through a bunch of different issues. So some of these issues that we were facing at the time, it was summer in Texas, which, if you can believe, it was not as hot as what it is today. I feel like this summer has just been such a different level of hot, but I digress. With this patient, it was summertime and it was hot, and this patient felt most comfortable and safest walking around inside of her apartment complex. But we knew we had the summer heat to contend with. So what we did is we worked it into her schedule to where she would get up in the mornings and walk before it got hot. And after a few weeks of doing this, of her walking, and it literally took months to get this patient confident to the point she wanted to pursue this. So it was a long journey. After just a few weeks of her walking around in her apartment complex, she felt better. She really did. Now, did I take away all of her pain? No, of course not. But she felt better because she was getting up and walking around. It was helping to manage some of her pain a little better. She felt like she was actually doing something helpful for her body. And she felt a sense of accomplishment after all this. So, feeling really good, I actually went away for a few days to go and visit my sister. And by the time that I came back, I had to spend the remaining 4 weeks of my employment at this institution picking up the pieces. Because while I was out, I had a sub-therapist who came and treated this particular patient. And in the span of 2 visits, my patient had decided that she was no longer walking, she didn't want to come to PT anymore, and she basically gave up all semblance of hope because of what this therapist had told her. In short, this therapist told her that the reason she had metastatic breast cancer is because she was fat. And the whole reason that she was dealing with lymphedema, which was one of her impairments we were addressing, is because she was fat, and then she was never going to do anything that could possibly help any of the situation. Now, if you've listened to that previous episode where I talk about this, you know how upset this makes me. And I'm trying to keep it really concise today because I don't need to go off the rails again. But this is just another example of an all too common experience that patients face in cancer rehab. And I pray it's not you. I hope to God, to the universe, that this is not you. But the amount of times that I have encountered this in my own practice where I am picking up the pieces of my patients who have been just completely run over by other therapists who should know better, it's mind-blowing how commonly this occurs. And I tell this story because it is such a powerful reminder that through our expertise and compassion, you can contribute to a true healing experience for your patients. Even if we know that the healing of the cancer is not going to happen, right? when it comes to metastatic breast cancer, that is not, like, cure is not the end goal. I want it to be. I wish it is for our patients, but realistically, I know that that is not what we're working towards. What we're working towards in that case is independence and functionality and quality of life. And we were doing all of these things with that patient before this other therapist, this sub-therapist, came into the picture. You can, as a compassionate expert, contribute positively to this holistic living experience for your patients, especially those who are facing the challenges of cancer treatment and survivorship, whatever that looks like for them. And I firmly believe, because of what I've seen with other clinicians, both in my area and out of my area, that specializing in oncology physical therapy sets you on a path to gain some really important knowledge and perspective and critical decision making that only benefits your patients. And while you may be thinking, Elise, I don't know if that story really supports specialization, I do believe that, and here's why. If you have the knowledge behind how to show up as the best possible onco-PT for your patients, because you're more confident in knowing how to best address the impairments your patients are experiencing, you're not worrying as much. You're not stressing out as much. And I'm not saying that's the only reason why this PT was such a genuinely, like, trashy person towards my patients. I do believe that had this PT been a little more confident in dosing appropriately and actually working with oncology patients, that they would have shown up with a little more emotional intelligence and, frankly, capacity for the patient. Would that have fixed everything? No. But I do believe that when you have a deeper understanding of how to treat these patients, you show up better as a clinician. And that is what your patients deserve, and I will die on that hill. Moving on. Number 2 reason to consider specialization is the rising demand for specialty physical therapy care. Now, the demand for specialized healthcare is rising every day. We know that as patients get sick, they need to be able to access the most appropriate care for them. And in this case, physical therapy specialized for oncology is exactly what these patients need. As the field of oncology is evolving, which it's literally evolving every single day, like there are new immunotherapies coming out every month, for example, the need for experts in cancer rehab, aka you and me, who understand this very dynamic patient population and the side effects of treatments and how treatments ultimately affect your patient's function, it's overwhelmingly apparent how desperately this is needed. You already know, because we've talked about this and because you work with this patient population, that our oncology patients face very unique challenges compared to other patient populations, which further demonstrates the need for experts who understand, again, not just the cancer aspect, but can zoom out and also appreciate this is how this person is working within their little ecosystem of just being a human being. And then throwing the cancer stuff into each of this. We need experts who understand the intricacies of cancer treatments, the specific needs, ultimately to make your interventions more impactful and beneficial for the patients. And if I haven't already convinced you of how desperately this is needed, consider a few of the numbers. So, as of the time of this recording, it is 2023, which means we are about 18 months or less, actually, away from 2025. And the reason 2025 is such an important year, or should be such an important year in your mind, is this. We are anticipating that 50% of Americans alive in the year 2025 will experience cancer at some point in their lifetime, as in will be diagnosed with cancer themselves at some point in their lifetime. 50%. The number of survivors that we are looking at exceeds both those who have a heart attack and those who have a stroke combined in the US. Hooray that heart disease is no longer going to be the number one problematic disorder or disease in the United States, but hot dang, cancer is quickly taking up the slack, and I do not like it, but this is our reality. And so simply put, more people diagnosed with cancer means more patients in need of cancer rehab because they are going through cancer treatment, experiencing the side effects and impairments as a result of all of this. This also means that more patients are surviving their cancer diagnosis longer. Again, more people living with the side effects and impairments of cancer and cancer treatment, ultimately affecting their ability to do what they want to do and need to do. This also means that more patients are living longer, therefore developing long-term complications and side effects of these cancer treatments. And this also means that more patients are living long enough that they're developing other conditions, other musculoskeletal problems in need of PT. And it's not just that they're going to need PT, it's that they need a physical therapist who understands what it means that they went through cancer and cancer treatment years prior. How is that potentially affecting their range of motion in their shoulder? Insert whatever impairment here, right? No matter the setting, no matter the specialty, no matter where you work, no matter the patient population that you are hoping to treat, you will encounter patients with cancer and after cancer treatment. Specialization ensures that you are prepared and ready for those patients. Specialization ensures that patients who come and see you are going to receive care that is appropriate for their needs and for their impairments. And that is what we are really after here. Number 3, enhance clinical skills and expertise. I touched on this briefly. Let's dive into it more. No surprise. Specialization requires you to have a very deep, intimate understanding of whatever focus area we're talking about here. And of course, this is the OncoPT podcast. We're going to talk about OncoPT things. As you immerse yourself, as you are going forward with the specialization process, and as you are diving into the material that you need to cover as part of the oncology specialization process, you are developing a refined set of clinical skills that are very much tailored to the complexities of the oncology patient population, right? Their cancer and cancer treatment related impairments. And this heightened level of expertise as part of going through this process enables you to create more personalized treatment plans for your patients, not just for the physical limitations that we know this patient population can experience, but also considering the emotional, psychological aspects of your patient's journey, right? We know our patients are not in silos. We know our patients are not just, and this is in the heaviest of quotes, okay? We know our patients are not just cancer patients, quote, 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 right? These patients are humans who have whole human lives outside of this that was probably, I'm going to say 99.9% certain, completely derailed and just upended with this diagnosis of cancer. And these other issues that patients are facing, whether those are physical, emotional, psychological, they don't just go away and get better because a person has cancer. In fact, we know that sometimes these other conditions that the person is experiencing only get worse as a result of the cancer, period, but also the cancer treatment. And so we need to be able to respond appropriately to curate very precise treatment plans for our patients that consider all of these very dynamic, complicated, multi-layered aspects of just existing as a person with cancer. One of the most impactful benefits that my students have seen and noticed as part of the specialization process is anticipating potential concerns and complications before they even happen. So you may be aware of different, oncologic emergencies in addition to the various red flags that patients can experience who, can ultimately come to physical therapy for any number of reasons. But with specialization, you command a comprehensive understanding, truly comprehensive understanding of what your patients are experiencing, not just here and now, but also the potentials, what they could face. And again, maybe that is as a result of the cancer. Maybe that's the cancer treatment. Maybe that's the side effects as a result of the cancer treatment. Maybe it's an interaction of these things. Maybe it's not even just the physical things, right? Limitations, side effects, but also, again, that emotional, psychological experience of that patient. What are some things that they could be experiencing that I know as a specialist to look out for in my patient population? And not only is this helpful because when you encounter, again, insert issue here, you're ready for it. You know what to do when that happens, but this also catapults the effectiveness of your treatment plans because you can not only retroactively, respond to a situation, you can proactively manage potential complications and address these ongoing complications or even developing complications for your patient as they happen or as you anticipate them to happen. And the whole reason this is beneficial, obviously not just for the reason of catching things early for the sake of let's not let a DVT slide past us and become really problematic, aka fatal in some cases, but this helps your patients get better more precisely, but this also helps to save them time, money, and energy and frustration over time. Because if your interventions are more tailored to your patient's needs because from the work that you've done to become a specialist, to specialize, you're addressing the impairment faster, your patients are healing faster, getting better faster, they're happier because they're not spending all their time with you, which again, friend, I know that you're obviously the best onco PT in your area, and I would love to come and spend a bunch of time with you. But I bet your patients don't necessarily want to spend all of their free time in your clinic or in your presence, right? They want to go and do things that they want to do with their family, with their friends, with their loved ones, right? So again, as much as I know they love you, they probably don't want to spend all their time with you. So again, because they're not having to spend so much time in PT doing all of these things, they can get back to doing what they actually want to do and what they like to do much faster. And of course, that's going to make your patients happier over time, but it's really, really going to improve and add to their quality of life experience, even in the face of such a catastrophic and just frankly crummy diagnosis altogether. So as you can see, the knowledge that you are amassing and really learning over time as you specialize is not just helping your patients here and now, but is also helping their families and their communities and their neighbors now and in the long run. And this is perhaps one of my favorite things when I think about the oncology field and working with patients who have been diagnosed with cancer. This is probably this is what I have figured out is the why I am here, like on this earth. Because yes, I love being here and getting to work one-on-one with my patients. Like that is one of my most favorite things ever. But I think what I love, it's like an unspoken thing in my brain when I'm working with these patients is I know I'm not just helping that patient here and now, which is obviously like very important. But I've been able to see, now that I've been practicing for a few years, I'm able to see just how much a family, a neighborhood, a community is affected by a person diagnosed with cancer. Particularly, and I wasn't expecting to go here in this episode, but I am going to go here in this episode because I think it's such a powerful example in my own life of how I've seen this. So earlier this summer, we had a friend. She was an acquaintance of mine. She was a friend of my husband's who died from cancer, and it was sudden. It was unexpected. She was so young. Like it was just a wild set of circumstances that ultimately transpired. And we were at her funeral. Wow. Again, didn't expect to go here, but here we are. We were at her funeral, and of course it was beautiful. But one of the things that was so interesting to me in a beautiful way is how many people showed up and were so deeply affected by this one person. But perhaps more profoundly, this one person's absence. And them not being there anymore was very visibly shocking. And that, I think, as I've been coming out of this grieving process, or at least like moving through the grieving process, as I'm learning in my own therapy, you cannot move out of grief. You have to ride the wave. But as I'm moving through this grieving process, it's been interesting to see how that perspective shift has happened and has affected my work as an oncology physical therapist because of the personal loss that I have faced regarding cancer. I've never actually had that before. I've never lost someone to cancer in my personal life. It's always been professional. And so I think, like I said, this summer has been such a catalyst of seeing how one family, neighborhood, community is affected by one person's diagnosis of cancer, and how it truly ripples throughout that, and how much more it has really lit a fire under my butt to make sure that these patients are getting the care that they need, because it doesn't just affect them and it doesn't just affect their families. And I know, like, it is absolutely something that just ignites a fire inside of me of, I don't want any patients to ever be treated how my patient with metastatic breast cancer was treated all those years ago. Because I know that didn't just affect her, it affected her family, it affected her neighborhood, it affected her community, and the rippling out that takes place as part of this is so profound. And like I said, very eye-opening. And I see that now, and I appreciate that now more than ever. And I would really encourage you to think about that. It's not just here and now for just your patient. It is truly widespread, long-term, that you are having an impact on this community, and we need you out there doing really, really good work. Okay, we're going to move past my little emotional stuff that clearly is still very present and heavy on my heart, but it means a lot, and I appreciate you making the space for me to share with that. So, moving on. Next reason why specialization is so important is potentially career advancement and opportunities. And I don't want you to think about this as just one-sided. Let me explain. Specialization opens a realm of doors and opportunities and possibilities to some very exciting potential developments for you in your career, and not just at your current setting in your current facility, but even beyond. So first and foremost, specialization signifies and demonstrates your commitment to professional growth and improving the field of cancer rehab. Now, your employer may have established clinical ladders or other perks that come along with being a board certified specialist. Maybe this is increased status, maybe this is increased compensation. That's cool. That's dandy. And if you know that your employer is going to increase your benefits or your compensation, or both, as a result of your specialization, amazing. I love that for you, and frankly, I am jealous of you for that, because that is definitely not the norm that I see across the board. But with that should definitely not be the only reason that you choose to specialize. I'm going to actually focus our time more on other career advancements and opportunities that commonly people don't think about. So specialization serves as kind of like a springboard, right? A diving platform for you to jump off of to advance your career by becoming a go-to expert in your field. Again, board certification really serves as this testament to your dedication and proficiency in oncology care. And because of this helps you earn credibility among your colleagues and your peers. And of course, obviously, it feels really good, personally, as I flip my hair here on video. It feels great to have a good personal reputation of wow, that person is really smart. They really know their stuff. But perhaps more important is the professional reputation that you were helping to curate. But even beyond that, I'm talking to you right now, your board certification, your specialization helps to elevate the reputation of the profession as a whole. Again, let me spell it out for you. Real-time example. I have worked with many oncologists in my area, but I have tended to work most closely with a particular practice. And because they tend to refer their patients to me, that's how I get to know them. I also had a pre-existing relationship with them because my mom used to work there. And so again, I have benefited greatly from those network connections. Moving on from that, I have a lot of work to do personally in my own private practice to undo even their perception of cancer rehab and the quality of care that patients get when it comes to cancer rehab. What I mean by this is that those oncologists and the other oncology team members, NPs, PAs, MAs, etc., they have been burned by cancer rehab in the past because their patients have consistently been run over by therapists who do not have the time, who do not have the energy, who do not have the passion to care appropriately for this patient population. And so what happens is these patients are treated subpar. The patients come back to the oncologist, or insert professional here, and say, I'm not happy with it. It didn't work. I wasn't listened to. And that reinforces the negative stereotype of that professional regarding cancer rehab. Even though they know that if they come to see me, they're going to have a very different experience, they know, because enough patients have talked to them about it, that that is a very consistent experience that they have, that they can expect in the Dallas-Fort Worth area. Unacceptable. Absolutely unacceptable. And even with the personal experience I have with these oncologists, I cannot outdo years of this behavior, of this experience for their patients, for the oncology team, right? And so when we consistently practice at the top of our license, delivering the best quality care for the patients, this is how we change the face of cancer rehab. And a big part of how we do this is by specializing. Because again, when you specialize, you command a more comprehensive understanding of this. You can better show up for your patients. You know more of what to do. You can make better use of the time and resources you have with that patient to ultimately get them to where they want to go. And I'm not saying that I'm putting the responsibility on you to change the public's perception of cancer rehab, but I will be darned if I'm not going to put at least some of that responsibility on you, because we have had far too much of this poor performance cancer rehab in general. We can't do that anymore, right? It's 2023. It is time to have better professionals in cancer rehab to actually deliver primo care for our patients. Last example I'll leave you with in this. So again, this is a really, really good example. I have a patient that I'm seeing right now. She's a newer patient on my caseload. And the reason she came to me is because I am her fourth physical therapist for her lymphedema in the past 2 years, like not even 2 years at this point. And after working with this patient, I feel very confident in that what she is telling me is very much the situation. I don't feel like this patient is one of those who is shopping around. I genuinely feel like she is seeking out the care to actually get her issues taken care of. So most specifically, her most recent lymphedema therapist prior to me, when my patient was telling her, hey, my nighttime garment isn't working, I'm having some pocketing, some poofing out around my elbow, etc., this therapist looked her square in the eyes and said, you should just be happy to be alive. And again, I don't know who this therapist is. I genuinely don't. But I do know that is absolutely unacceptable in any kind of physical therapy care, but perhaps most especially in cancer rehab. So what did this patient do? As she should, she discontinued care with that therapist, went back to her oncology team and said, I am unhappy and I don't know what to do at this point. And so it was only at this point where this patient had basically exhausted all other options that the oncology team member said, you know what, I think I remember Elise, I'm going to refer you to her. And finally, this patient is now making progress that she should have made, frankly, months ago, but didn't have an appropriate care team. I am not the best therapist in Fort Worth, y'all. I am not the best therapist in Dallas-Fort Worth, in Texas, period. But hot dang it, if I don't end up with a bunch of patients who have just been through the ringer time and time again. And I know it's because there are so many therapists who are not training appropriately, who understand this material, who can then better show up for their patients. And I know that as a profession, this is keeping cancer rehab down. So again, all this to say, as a board certified specialist, you basically have the world at your feet. Like, the world is your oyster because of how poorly cancer rehab has been delivered across the board for a really long time. You have the potential to show up and become an automatic go-to expert and resource for your community. And those oncologists and those oncology teams pay attention to that. And I tell you what, y'all, like, when I sold that one oncologist on my care because my patient went back and was like, oh my God, this is so much better, that person is going to refer to me probably forever now because I showed up the one time it really counted for her patient and I delivered. And that is how you are going to be with your comprehensive command of oncology care. Now, whether or not you've considered this, specialization in oncology can also lead to leadership roles. And again, this may not be something that you've totally thought about, but specialists, aka you and me, are well equipped to guide multidisciplinary teams. So again, collaborating with physicians, with nurses, with PAs, with NPs, with MAs, and other healthcare professionals to truly provide this comprehensive care that is so important to our patients. One of my friends, Scott, is very much in this role within his organization. Like, he is part of a truly multidisciplinary team that does a lot of shared decision making for the betterment of their patients. And while the oncology team members, right, oncologists, NPs, PAs, etc., may not fully understand what all goes into cancer rehab, what all goes into being a board certified specialist in oncology, they speak that language, right? They understand board certified because that's something that they recognize within their own profession. And so that automatically elevates you at first glance of, wow, this person really knows their stuff. Now, aside from leadership, you may also be interested in research. And because of this specialized knowledge that you gain in oncology, you can be better equipped to engage in more impactful research. Maybe this is you investigating novel rehab techniques or contributing to the development of evidence-based guidelines, right, and practices. That is something that is a really big part of cancer care. You can play a very pivotal role in helping to advance the field in this way. So again, I hope we have zoomed out enough to really kind of flesh out just some of the ways that specialization opens up a whole realm of opportunities for you and your career beyond just the pay change. That may or may not be a part of the motivation for you, but it has been really cool to see just how much more of an impact that specialists that I know in oncology are having in their local and even like statewide roles now because specialization opened up the door for them. As a specialist, again, you have really solidified your commitment to advancing the profession and providing best care possible. And that really enables you to drive positive change within your communities, maybe even on a bigger scale. And so I would really, really encourage you, specialization, very, very cool way of doing that. Now, lastly, when it comes to reasons to specialize, include personal and professional fulfillment. Beyond the career growth that we've been talking about, specialization really taps into this spring of personal and professional fulfillment that stems from transforming the lives of your patients, and not just transforming them, but being very aware of just how you're transforming your patients' lives. As we've discussed, you have a very profound opportunity to positively impact your patient's life and quality of life. And by competently applying your expertise, you're helping your patients regain their independence and so much more. And I don't know about you, but that makes me feel really good when my patient can walk out of my clinic and better be able to do XYZ, right? Whatever that is. Picking up their child, applying their own, compression for their lymphedema, getting to go on vacation with their families and not being so self-conscious of like, oh, like I know I'm feeling this way and I can't do this thing. No, like they're better able to do that. And dang it, that makes me feel really, really good. When I was first practicing, I did not feel that. I felt a lot of frustration, stress, and even fear about if I was actually helping my patients with my plans of care. I genuinely didn't know if they were working. Or it took me a really long time to assess, like, how can I change it to actually help my patient do XYZ? After specializing, after going through this process of very intimately getting to know the ins and outs of oncology care, I'm extremely confident with curating my treatment plans and making them work for my patient, this whoever happens to walk through my door, right? And this means that ultimately I am less stressed and fearful and frustrated when it comes to practicing. I can connect better with my patients on a human level to really form that therapeutic alliance that is going to make therapy work for my patients. And it's because I'm not freaking out all the time. Looking back, I genuinely wish I had this kind of perspective and insight into being an onco PT when I first started. Like when I first started my very first onco PT job, I wish I had that kind of confidence to reflect and say that. Because I know how good I feel now. I know what it feels like to start my workday and be able to know with confidence that even if I don't exactly know who's going to come through my door, what they're going to be experiencing, I know that I can help them with it, and I know that I can take treatment plans and tailor make them for my patients. Because the satisfaction of doing a good job for my patients and knowing I'm doing good work is enormously comforting to me. Even though I say I wish I could have done this earlier, I know I couldn't because I didn't have the hours of specialization that I needed to actually pursue specialization. But I'm really glad that I pursued specialization as soon as I did, as soon as I was able to, because I know that made me a better PT in a very short period of time. That process would have taken me years to do what I did, honestly, in about 8 months, start to finish. If you're worried that you're not ready for specialization yet, hear this. So if you've zoned out, come back to me because this is really, really important. We specialize to become the expert. When you better understand the side effects of cancer treatments, the cancer itself, the interventions that are best supported by the literature to actually address your patient's impairments, you become the expert that your patients need. You don't specialize because you're an expert. You specialize to become an expert. And that's a very, very specific distinction that is so, so important. And I hope I've convinced you to very seriously consider starting the specialization process. If you are ready to dive deeper into specialization, I'm hosting a free live webinar all about how to actually get started on the specialization process, particularly with your ABPTS application, right? That's kind of the gateway to get all of this process started. So my free webinar is taking place on September 13th at 7 p.m. Central Time, and it's called Start and Actually Finish Your ABPTS Application by the Deadline. And we are talking about the upcoming September 30th deadline. This is an extremely timely live class that I am teaching. I am on there literally live going over this material with you. And we are targeting this on how you can actually get started now, as in on September 13th, and have a finished case report ready to submit even before the September 30th deadline. And I would really, really encourage you, even if you're not going to specialize this year, you don't want to miss out on this free class, because I'm taking you all behind the scenes of what exactly you need, how to make a really strong application and case report. And ultimately, if you know you're ready to get this taken care of, I've also created a resource, a very, very special resource that is going to teach you exactly how to start and finish your case report in 14 days. Yeah, if you're feeling the crunch, this is for you, my friend. So again, we're going to chat all about how to navigate the ABPTS oncology application, the most important part of your application, aka your case report, my best tips for selecting the patient case that is best for your case report, and how to actually finish your case report by the upcoming deadline. And again, that is September 30th if you haven't been paying attention. So make sure to save your seat at theoncopd.com/ABPTS, and I will see you there. Until next time, this is Elise with the OncoPT. And remember, you are exactly the physical therapist that your patients with cancer need. So let's get to work.